Hi guys, and welcome to my haematology video, and in this video I'll be covering an introduction to haematology as well as an introduction to anemia. So the learning objectives for this presentation are to define anemia holistically. So this is not just what is anemia as in the disease, it's about all the factors which contribute to make you in an anemic state. You need to appreciate the importance of the different anticoagulants and containers for the different blood tests which can be performed in the lab. So these are little vacuum containers which are found in your haematology labs, for which they store the blood in for when they're about to perform the biochemical analysis. So you can describe the main components of a full blood count, or FBC as it's abbreviated to. Describe the morphological changes which can occur as a result of diseases. So these are all the different morphologies you can actually visualize under a microscope, and you can see the different shapes and sizes of the red blood cells itself. And to appreciate the importance of micronutrients such as iron, folate and vitamin B12, as well as their transport and storage molecules. Okay, so now we're going to start off by just saying what is a general definition for anemia. So I'm pretty sure that most people define anemia as just like a blood deficiency or somewhere along those lines, but it's not just as simple as that. There's many different things which contribute to an anemic state. So anemia is a reduction in the oxygen carrying capacity of the blood due to either a reduction of circulating erythrocytes, so this can either be as a result of hemolytic anemia, blood loss, or impaired production of new erythrocytes, or it can be caused by defective oxygen carrying capacity of hemoglobin itself, so not just impairment of the red blood cell, but down to the more molecular level, so how the hemoglobin molecules themselves are impairing oxygen carrying capacity. So here's just some general signs and symptoms which you can see when you're in an anemic state. Some of the general signs that are specific to some of the anemias can include like the pallor of the mucous membrane, so how pale your mucous membranes are. This can be seen by just either looking at the lips, or even like more quickly you can just literally just look at the base of your eyes, and depending on how pale they are depends on the severity of your anemic state. But as I said, some of the more specific ones can include the curving of the nails. This can be occurred as a result of a long-term iron deficiency. So instead of your nails being curved as they normally are, they can either be flat or they can be inverted, so curving the completely different way. You can also become jaundiced. So jaundice could be as a result of hemolytic anemia. So the red blood cells are bursting, the hemoglobin is then being released, the hemoglobin is then being metabolized into bilirubin, and the excess of bilirubin in the body can then form the jaundice, thus the yellow skin, yellow eyes, etc. You can also get something called glossitis. So glossitis is when your tongue becomes inflamed. The inflammation of the tongue is usually associated with B12 deficiency. And also you can get leg ulcers. So leg ulcers are one of these symptoms which are specific to sickle cell anemia. Any sort of bone deformities can be as a result of any form of thalassemia. And it doesn't matter what sort of anemia you've got, you can get these generalized symptoms such as your shortness of breath, weakness, you're lethargic or tired because you haven't got the energy, because obviously you need oxygen for your metabolism, and also headaches. Okay, so here is the general colour scheme which are used for the vacutainers. So vacutainers are small plastic or glass tubes which are used to store and contain blood ready for their lab analysis. So all of these have got a different colour scheme as I just said, but these are associated with depending on what's inside them, so either the items or the additives associated with it. Some of these could be procoagulatory, so this is when you store them and you want them to coagulate. So for example, in your red and golden tubes, you've got things which promote coagulation. So this is when you want it to be coagulated, so you can use these for clinical or serum biochemical tests. Or you could store them in the anticoagulator, so you want them as really fine liquid form. So here you can use chelating agents such as EDTA in the lavender ones. You can use sodium citrate in your black ones. All these are anticoagulants. And these work by chelating to free-flowing calcium ions in your blood. And calcium is really important for coagulation. So what these do, these bind to calcium and prevent them from initiating the coagulation cascade. Therefore, act as an anticoagulant. Okay, so now I'm going to start talking about the classifications of anemia. So there are many different ways you can classify anemia. So you can do it based on the morphology, size, shape, colour, whatever. Okay, but we're going to start off with the absolute basics way of how we have always pretty much classified things. So as kids, we can classify things as big, normal, or small. So that's exactly how we're going to start off with anemia classification. So we're going to start off with small, medium, and big. Okay, so also when I'm talking about anemia, in this case I'm talking about anemia associated with red blood cells, okay? So not white blood cell leukemia, this is purely based on red blood cells. Okay, so when your red blood cells are smaller than usual, so they are microcytic or hyperchromic when they've got a lack of colour, this is when they're smaller than usual, okay? So this is when they've got a cell volume of less than 80 femtoliters or a hemoglobin levels of less than 27 picograms per cell. Okay, so these are characteristics for those who are suffering with iron deficiency. So obviously if you've got a lack of iron, you're not going to have as much hemoglobin packed into one of your red blood cells, so it is going to have like a smaller than usual volume. Same thing for thalassemia, when you've got an impaired hemoglobin molecule itself, again, a reduced size in your blood cell. But also could be as a result of lead poisoning or any sort of anemia associated with chronic diseases. And then we're going to start talking about normocytic. So this is when your red blood cells appear normal in shape, so normal size, normal shape, and normal colour, but you are still suffering from anemia. Okay, so this is when your red blood cells have a normal cell volume, so this is about 80 to 95 femtoliters, and a normal hemoglobin level. So this is anything equal to 27 or just slightly above it. Okay, so as long as it's not below 27 picograms per cell, that's when you know these are normal sized red blood cells. Okay, so when you've got normocytic anemia, this is usually associated with hemolytic anemia, okay? So this is when your red blood cells are bursting, so you're having a fewer number of red blood cells. However, you can also get it as a result of blood loss. So again, you've got a lack of red blood cells, so you're not going to have as much oxygen carrying capacity of your blood. It could be, again, associated with anemias of chronic diseases, renal disease, or any sort of form of mixed deficiencies, and etc. Okay, then you've got macrocytics. So this is when your red blood cells are larger than usual. But you might be thinking to yourself, if a red blood cell is larger, does that not mean it's carrying more hemoglobin? So does that not mean I'll have more oxygen carrying capacity? Yes, but no at the same time. But when you've got macrocytic anemia, so this is when your red blood cells are larger than 95 femtoliters in volume. Okay, so red blood cells have a unique size and shape. Okay, so they're a biconcave disc, and they have that unique size to them. Okay, but when they're too big, they take on something like a spherical shape, so they hence start becoming spherocytes, so they're round in shape and not this biconcave disc. So they're going to have a less surface area to volume ratio, so they're not going to absorb as much oxygen into the hemoglobin, so the oxygen binding affinity is not optimized. But also because they're large, they might not be able to deform themselves easily in order to navigate through blood capillaries. Remember, some blood capillaries are literally one set, like they can literally just fit one red blood cell through at a time. So the red blood cells need to be able to deform regularly and to be able to navigate themselves through these small blood capillaries. Therefore, if they are too big, they might cause blood clots in these smaller capillaries, and they might cause huge amounts of damage if it goes on for too long. Okay, so you can get macrocytic anemia as a result of vitamin B12 or folate deficiency. And also, just to make you aware again, folate is another name given to vitamin B9. And also you can get non-megaloblastic, so this could be a result of too much alcohol, so alcohol poisoning. You can have liver disease or myelodysplasia, etc. Okay, so we've discussed how they can be big, normal, or small shape. Now we're going to talk about the morphological characteristics. This is known as poikilocytes. So this is when their shape itself is different, and anisocytosis is when the size is different. Okay, so here we can see what a normal red blood cell will look like underneath a microscope. So you can see this characteristic red around it, and a small white patch in the middle from where you've got the biconcave disc and it dips in, so more light is able to pass through this bit. So as we've seen, so macrocytes are large red blood cells, and if you notice they haven't got this white indentation, this is because they become spherical in size, so they might be called spherocytes. And again, these can be as a cause of liver disease, alcoholism, etc. And down here you can see the macrocytes. So as you can see, they've got no coloration, so they've got really little hemoglobin in them. And as a result of iron deficiency, this means you're not getting as much effective hemoglobin. But you can also have really sort of unique and shapes to some of these red blood cells. So for example, you've got target cells, which have your red banding around the outside, then you've got your central white. But then if you look carefully, you can see another red circle in the middle, almost like a bullseye. Hence, they can get their name as a target cell, so they literally look like a target. You can even have some which have really sort of elongated shapes. So you can have like pencil cells, which again are started from iron deficiency. But you could also have elliptocytes. So this is caused by hereditary elliptocytosis. But when you're looking underneath a microscope, you really need to be careful to distinguish between these two. Okay, the best way to distinguish them is with elliptocytes. They are broader, so they're slightly wider, and also there'll be a lots of them, because when you've got hereditary elliptocytosis, this is a genetic condition, so you can have lots of these in comparison to pencil cells, where you might just only have a few every now and then. You can even have them so their actual membranes themselves are distorted, such as the echinocytes and acanthocytes down here. As you can see, the spiny protrusions on the echinocyte, and then on the acanthocyte you can see that there are still these protrusions, but they're not as sharp. You can also have these microspherocytes, so again, small spherocytes. So they're like the macrocyte in terms that they are round, but they're not as big. You can also get your fragmented red blood cells, so these are literally fragments of red blood cells. And also some of the most characteristic shapes you'll be able to see are your teardrops. So this is a poikilocyte. This is where the term poikilocytes comes from, so abnormal shapes. This could be as a result of myelofibrosis and extramedullary hematopoiesis. And again, some of the ones that a lot of people will see under microscopy, if you've got this condition, is sickle cell anemia. Okay, so when you have sickle cell anemia, you're going to have these sickle shapes, and hence why that's how it's come from the name sickle cell, because the red blood cells are literally in a sickle shape. But not only the shape of the red blood cells can actually tell you what's going on. Sometimes what's happening within the red blood cell can tell you what sort of disease is going on. So for example, if you spot normoblasts, so these are nucleated red blood cells in the peripheral blood system, this isn't normal. Okay, so normoblasts should only be seen within the bone marrow, so this is a site of hematopoiesis. So if you're seeing normoblasts within the peripheral circulatory system, this could be an indicator that your body is under strain, so it's increased its hemopoietic rate. So it's actually sending out these immature red blood cells into circulation in order to accommodate the increased oxygen capacity which your body is demanding. You can also have these Howell-Jolly bodies. So Howell-Jolly bodies are DNA remnants, so not the entire nucleus has been ejected, but you can still see these DNA fragments within the cell itself. You can get basophilic stippling, so these is denatured RNA forming by artifacts within the red blood cell. You can get something called Pappenheimer bodies. So these are iron-rich proteins which are characteristics in siderocytes. You can also have malarial parasites. So if you're examining a blood film of someone who recently contracted malaria, you'll be able to see these malarial parasites within the red blood cells, often as a little ring. You'll also be able to find reticulocytes. So reticulocytes are again immature red blood cells. It is normal to find these in the peripheral circulatory system, but not in large amounts, okay, because they do tend to finish off maturity within the circulatory system, ejecting this remaining RNA. And then also you'll be able to find Heinz bodies. So these are caused by oxidized hemoglobin within the red blood cell. Okay, so when you're doing hematology tests on a blood sample, it's not only just the red blood cells that you can look for. You also look at the leukocytes, so the white blood cells. You can also look at the actual molecules within it, so like ferritin, which is your iron storage molecules, transferrin, which are your iron transport molecules. And you can also just analyze the relative percentages of each within. You can also look at general numbers. You can do all sorts of tests. So one of the other widely performed tests is also known as the white blood cell differential. So this is when you're analysing the relative percentages of each of the white blood cells, and this can help justify whether a person has a certain type of infection, a certain type of leukemia, or anything. Okay, so for your neutrophils, your normal percentage is usually around from 40 to 75, and again, some of these values may change depending on what sort of resource you're using. Some might say 40 to 60, but for the sake of this, we're just generalising this to 40 to 75%. Okay, and neutrophils are specific for the phagocytosis of bacteria. They're involved in inflammation and scavenging and removing any debris within your circulatory system. Okay, so then you've also got lymphocytes. So you roughly have 20 to 45% within your blood system. And these are important for antibody production, so that's when your B cells mature into plasma cells to release antibodies. They can also cooperate with antibody production, so that's like your T helper cells. And then also you've got cell-mediated immunity, so destruction of cells. That can be for viral immunity or destruction of cancer cells. Okay, you'll also get monocytes. These can range from 2 to 8%, or some references might go up to 10%. Okay, so but again, these serve similar purposes as neutrophils, so phagocytosis, inflammation, and scavenging, removing debris. They're also involved in antigen presentation and also play a crucial role in hemostasis. You can also get eosinophils, so roughly 1 to 6% of all your circulating leukocytes are eosinophils. And these play a crucial role in parasitic infection and allergic reactions, and they can also release histamine. And then you've got basophils, so less than 1% of all your circulating white blood cells are basophils. And these play a role in your hypersensitivity reactions. They release histamine and heparin. So all of these are your different white blood cells and some of their generalized functions. Okay, so here's a picture of what you'll see underneath a microscope when you're doing blood smear analysis. So lucky enough, this blood smear shows pretty much everything which you'll be looking for underneath the microscope when you're analysing your blood drops. Okay, so this, just by coincidence, happens to show you all the different leukocytes you can see. So starting off here, you can see that this is a monocyte. So monocytes are characterised by their kidney bean-shaped nucleus. So you can see how the nucleus wraps around, indents, and goes out. Okay, so that kidney bean-shaped nucleus is characteristic for monocytes. Here and here, you can see neutrophils. So this neutrophil here has a band-shaped nucleus, whereas this one here has a multi-lobed nucleus. So you might make the mistake of mistaking this for a monocyte because it looks like a kidney bean-shaped nucleus. However, this is what's called a band nucleus. Okay, so it's not quite kidney bean-shaped, it's this unique shape which you will find mostly with neutrophils. And here you can see a lymphocyte. So lymphocytes are characterized by a much larger nucleus in relationship to the cytoplasm around it. So to identify a lymphocyte, you're just looking for the shape and size of the nucleus. Okay, so when you're staining your blood smears, you'll be using a Giemsa stain. So these have an acidic and a basic stain within them. Okay, so eosinophils will take up the acidic dye eosin within the Giemsa, hence giving it this red coloration on the granules. Okay, so that's how you can identify the eosinophil easily. So eosinophils are acidic, and often when you're doing like pH tests, the acids are usually red. So that can kind of give you the idea that this is an eosinophil. And again, characteristic, you get usually 2 to 3 nuclei as well. Then here you've got a basophil, so baso B blue. You can see that's taking up the blue stains with these granules, hence you can give it that. Hence it's called a basophil because it takes up the basic dye. And then again, you can see plentiful amount of red blood cells, and sometimes you might see small fragments, and these are your platelets. Okay, so once you've analysed the morphology and the several characteristics of the blood itself, you can then perform something called haematinics. So this is when you're analysing the micronutrients and plasma proteins. So here you'll often be analysing the iron within it, and also the amount of folate, which is vitamin B9, and also the amount of vitamin B12, both of which are essential for DNA synthesis. And iron is obviously essential for acting within hemoglobin to actually bind the oxygen to it. So some of these figures will depend on the labs you're working in, and some resources will again give you different references. But for the sake of these, this is from Moore et al. 2016, Essential Haematology. And again, the references can be different depending on if you're male or female as well, so there are many different factors to take into consideration. And also what it doesn't show on this is how age can relate it. So obviously if you're younger, you might have different variations in comparison to someone who's older. And here are some more blood smear examples. So we're going to start off with this one here. So what can you notice so far here? Okay, so some of the ones to point out, you can see some really irregular shaped red blood cells, so you can already tell that there's a type of anemia going on here. You can see a teardrop poikilocyte right here, and these really, really large red blood cells you can see here are macrocytes. Okay, so these are larger than usual red blood cells. And then if you're looking here, again, you can see plentiful macrocytes, so a lot of large red blood cells. But you can also see these inclusions within it. So here you can have how jolly bodies, and also you've got a nucleated red blood cell, so you've got an immature red blood cell. So this could be an indication of increased hematopoietic burden, so it could be a result of blood loss as a result, as you can see by the DNA present in these. And then you've got this nice big one here, okay, so there's plenty to see on this. So upon first examination, you can see a lot of normal red blood cells, but some you can consider here. You've got an acanthocyte here because you can see the spiny protrusions on the red blood cell itself. You've got, again, a teardrop one here. So, again, I can just recommend that you just go onto the internet, just literally just research loads of blood smears and literally just practice pointing out what you can see wrong, because it will help you when it comes to when you're working in a haematology lab or when you're doing like multiple choice tests, when you're having to identify what's wrong with a particular blood smear. And on the top of that, let's come to the test yourself section. So here I'm going to ask you a series of questions. I'm not going to tell you the mark scheme. I'm not even going to tell you how many marks they're worth. I'm going to let you decide that in your head how much it could be worth and how the mark scheme would go. So the first question is to define anemia. Remember, it's not just the anemia itself, it's a holistic definition of anemia. So here is a case study based question. So a patient claims they are suffering with long-term general weakness and tiredness. Upon blood examination, they have hyperchromic erythrocytes and a lower than average level of vitamin B12. The patient then states that they have been a vegetarian for several years. So what form of anemia may the patient be suffering from, and what would you recommend as a treatment option based on this information? So again, it's not a lot of information here, but you can almost, you could probably 90% pretty much guess what the case of anemia is here. So I want you to be the judge on that. And also, as I just said, go online and search for blood smears and spend some time going through the images and highlighting what you can see, because it will help you practice quickly being able to identify them, and also it can help you just get to grips with all the different morphological characteristics you'll be able to see underneath the microscope. Okay, so again, thank you for watching. This was a basic introduction to haematology and anemia, and as always, thanks for watching. And again, if you've got any questions which you'd like me to ask, post it down in the comment section below and I'll try my best to answer those. Thank you for watching. Peace out, guys and girls.